have found the ScribeAmerica documentation to be marvelous, wonderful. The physician that uses the Scribe says it has changed his whole clinic time. He loves coming to clinic now. The documentation has been good. Don't have to go back and fix anything. It's just well documented and accurate, no issues.
I belong to a medical practice group that is part of a health system, and we have it in our emergency room, and all of our emergency room physicians use ScribeAmerica and love it to death. It has saved them from their EMR, and we have since began to expand it to the ambulatory world, and we have 3 physicians using it so far, and they all love the quality of the experience.
So as a practice administrator, I've had the opportunity to communicate directly with ScribeAmerica, and I found their responsiveness not only to be quick, but they were very knowledgeable about the types of staff that they had available, and they asked a lot of questions about our specific needs, like what we needed the Scribe specifically for, what specialty, what practice, and what area we were in. I found it to be rather easy, actually.
Them quite frequently for some of our specialists, and they've been very responsive to whatever needs we have. They have sent in folks, trained them, and then just kind of over and over we will have certain tweaks that we may need. They've been very responsive. The folks will come in the next day and have a clear picture of what the needs are, so we've been very happy with that.
They were awesome. We got a situation where we needed a Scribe right away. We called. The first Scribe that came had no experience in pediatrics, which is what we needed, and so we called back, and they had another Scribe there the next day with pediatric experience, and came out to be sure that there was that it was working, that there was someone there that we could actually use.
Well, when we piggybacked off of the emergency room physician contract, we brought it over to the ambulatory world, and they were extremely responsive in getting the contract signed and negotiating, compromising on certain things. But we got that contract signed in a matter of 2 to 3 weeks, which is very fast in the healthcare world.
ScribeAmerica has been a great asset to our organization. Their collaboration, their planning, their pre-planning, it just really took all the anxiety of bringing in a vendor to our organization right out of it. The physicians that are using the Scribes now wouldn't go back to not using a Scribe, and they're telling all of their partners that this is a good thing and this is what they want to do.
We implemented our electronic health record 18 months ago, and it has been had a significant impact on our physicians and their ability to work efficiently. So we started the process of looking for a way to help them and came across ScribeAmerica. We've had several phone conversations with Dr. Murphy, and we actually have a site visit set up within driving distance that we're bringing a team to next Monday so that we can learn more about how that health system implemented ScribeAmerica, what were their successes, and maybe learn some lessons from them that we can avoid making any mistakes as we get started up. But we're very excited to be at this point in the process, and hope to have a great partnership in the future.
Well, we had a physician who was having terrible difficulty with the EMR. She was running 2 to 3 hours behind in her schedule because she couldn't get everything entered into our EMR system. So we called ScribeAmerica, and they brought a Scribe out, and the Scribe worked with the physician and got us to where she could be back on track seeing 30 to 50 patients a day. And without the Scribe, she was barely able to see 15 to 20. So we think that the Scribe really made a difference in how that office operated.
Physician quality of life has dramatically improved with Scribes. Physicians don't have to do a lot of that after work that comes with electronic medical record. They're able to actually get some of that done during the course of the day. And I think we've seen, even for our higher performers, their performance is still there, but it's much easier to get that accomplished because of the help of the Scribes.
Well, our physicians love it because they can concentrate on the patient rather than focus on trying to enter data into the EMR. So in one world, they have to look at the patient and then move to the EMR and enter the data. Now they just look at the patient, the whole visit, and it's great. They walk out of the room, the scribe has all their documentation done. All they have to do is just review it, click off on it, and it's done. So it's made them much more efficient.
Throughput is really important. Patients can't, we don't want them to wait inordinate amounts of time. And we know that physicians' time is very valuable, especially with the implementation of electronic medical records. It's supposed to speed them up, but it actually can slow them down with all of the boxes that need to be checked. And so having a scribe that's knowledgeable, not only about medical terminology, but about a particular system is very, very helpful so that the physician can concentrate on what they do best, which is seeing patients, rather than the documentation end.
You know what, that's a good question. The providers have shown an increased productivity, and they feel that that has to do with the scribes. They are able to get in probably almost double of patient load that they had before, where with a very busy specialty practice, they were like, okay, maybe we can get in 15. They're seeing close to 30 now, sometimes even higher numbers. And they felt that it has due to the scribes coming in, they can get their schedules done much quicker, patients in and out of there, and less questions.
Having an assistant or a scribe, especially from ScribeAmerica, makes it so much easier and so much more streamlined to see patients. All of the charting, paperwork is taken care of while the patient is there so that they can receive their visit summary right before they leave because all of the documentation is done. And that's what your scribes do. They provide us with that opportunity to get everything done for the patient while the patient's there.
It's allowed us to increase our patient volumes because the turnaround time on the patient visit is faster and the physician doesn't have to spend the time post-visit doing documentation, so they were able to increase their patient load.
The most recent experience that I had enabled us to free up some additional team members, mainly DMAs who are working alongside of the physician, and help to expedite the workflow of the patient throughput. So because the scribe was able to take on some of the additional responsibilities of the MA as well as the physician, we were able to see more patients on a per hour basis, which equated to more revenue for that particular practice.
Patient satisfaction scores, I think we've seen a dramatic increase because physicians are able to actually focus on the patient versus inputting data into the computer. So having a scribe in the room, they can put that focus right on the patient where it needs to be versus inputting data into the electronic medical record.
Over our pilot period, our patient satisfaction scores have increased for every physician that has participated in the program.
You know, we're able to see a lot more patients in a smaller amount of time, and the productivity has increased for these providers. They're very happy with it. Along with our management team too, they've seen an increase in patients satisfaction. Patients seem to be getting in and out of there with no longer long waits. We're able to get the patients in and out of there quickly.
Well, the nurses love it because it gets the documentation done. One of the physicians that using it is notoriously slow on entering his patient data, and this has the visit documentation done. So if a referral is made to a specialist or somewhere else, that's all done rather than having to wait for the doctor to get his documentation done.
They have embraced them, and the ScribeAmerica really comes in looking to be part of the team, not just to be standing on the side supporting only the provider. The scribes that we have in our office currently do anything they can to help move the visit through faster and provide a good experience to our patients. So it's more than just documenting in the medical record.
They have loved it. I actually worried about that because I thought they might feel a little bit threatened by their jobs having another person there, but they love the people that we have. They work together well. The scribes have blended in with our practice very well and just become part of our practice without being actual employees, but the other employees feel like they are. So they've blended in well and have made their jobs easier in some fashion, so they love them. The scribe that we have and the physician that he works with, it became a non-event. Having the scribe there and working with him we didn't have to do any additional training with that physician for ICD-10. The scribe came in and took care of it all and have had no issues at all billing out or getting paid since we had the scribe with him. Some of our other physicians that didn't have a scribe, it was harder, so I could certainly see the difference between the two. So.